But if we look, let's go back to the production side of it. On the production side, what we do know is that there's a number of studies that have looked at the comparison specifically of mental health issues related to women who are from the adult film industry. And so this is one of the studies looking at these issues. And by the way, I'll make these slides available, or the articles available if anybody wants them. But looking at kind of the ratio of just generally women in California versus adult performers, got 134 performers here, looking at their the incidence of things such as, for example, forced sex as an adult before they were younger. Looking all across this, what you see is vulnerability after vulnerability after vulnerability after vulnerability. These are women who are not just okay women who are just kind of looking for something to pass the time and make an extra buck. These are women who are inherently already in a vulnerable space. What we look at is that the predicting factors coming from a broken home, being neglected by the parents, or just being entirely abandoned by a parent, usually a father, having a history of substance abuse, engaging in stripping or prostitution prior to going into the pornography industry, early sexual experiences. Right? That's an important factor in letting you know who are the vulnerable women that we can exploit. Substance use, though, that is a big one, because substance abuse is something that will carry over into dealing and managing the outcomes. The majority of women who are in the pornography industry come back to substance abuse because of the emotional trauma that they experience making these movies. They are oftentimes coerced into doing acts by being given drugs, by given alcohol to help them get through a scene, which, by the way, does meet the legal definition of coercion. We look at just the broad array of mental health issues that these women struggle with: depression, suicidality, bipolar disorder, personality disorders, borderline, for example. Anxiety disorders, but post-traumatic stress disorder is a common thing. They are immersed in this industry. They leave behind their old social networks. And generally, their health. It's not uncommon for them to lose their financial security once they leave the industry. They generally don't make good decisions or make wise investments when they're in the industry and they have the money. That they may be paid a certain amount of money to do a ridiculous sexual act, and so they'll do it, but the next time the request is made, it'll be a little bit less. And so they're doing the same job, so to speak, although sex isn't a job, but they will be exploited by systematically what started out as a $10,000 shoot now becomes a $5,000 shoot, now becomes a $1,000 shoot, now becomes, we'll pay you $500 to be an extra in this gangbang. So systematically they're being exploited, and so physically, what you find is they have to have some significant bodily repair surgical procedures that are done. Some of them have gotten enlargements in order to kind of think of it as an investment to get more work, right? Where they get breast enhancements or vaginoplasty. And so this is stuff they have to live with.